Good evening. Welcome to another episode of the International Grapevine. This is your host, Wallingford Lee. Tonight on the Grapevine, we're going to be talking about a very important situation, which is menopause. How menopause tend to affect certain women, the pros, the cons, our sisters, our aunts, our mom, and even our grandmother in certain cases. So we want to take this opportunity on the International Grapevine talking about the various issues of menopause and more importantly, how to care for yourself and why you should always talk to a doctor about these things. And matter of fact, before the menopause come, to you there's a pre-menopause, and you'll have certain feelings that will warn you what is going on. And once again, we have as our special guest a wonderful person that we have had the pleasure of working with in the past, and she has been kind enough to be back on the International Grapevine. This lady has been a total support to the community, various communities in New York and in out of the country. And of course, it gives us a great deal of pleasure and satisfaction to have her back on the International Grapevine. I'm talking about Dr. Carol McIntosh, medical doctor, obstetrics and gynecology person. And it gives us so much pleasure to have her on because the last program that they did was so well received, even in Costa Rica and certain parts of Panama where we
Mm.
sent it out. So this give you a flavor that this lady will tell you so many things and that will open your mind and tell you where you can get help. Welcome to our international program today, Dr. McIntosh.
As always, Mr. Lee, it is always a pleasure, and I thank you for having me on the program, and thank you again for your having these programs as well.
Well, you're welcome. I think these programs are definitely a big plus. Um,
Mhm.
my daughter visited me from New York yesterday, and at the table she says to me, "Pops," and I say, "Yes, honey." She says, "I have menopause," and I'm telling you, it was a little emotional. But I
Mm.
understand, and we talk a little bit about it. So having your program did help me to talk to her with certain things, and I gave her a couple of books and stuff like that. And she left here early this morning, and it went through all right. But I'll turn the grapevine on to you because you're the one who can bring all these information and the pros and cons of them.
Well, I know that you have done your homework, so I may be bringing stuff. I just prepare for when you start to ask the questions as well.
Okay.
But I'm glad that you said that about how your daughter said that she was in menopause because we spend time when a baby's born, we talk with the children, we talk about them growing up. When we go into our first period, the books come out, the discussions, the questions. But this is our next stage, and no one says anything. We don't know. And it's again the same type of thing. We should have education about each stage of our life so that you're not surprised and you understand what can be done about it. So I'm glad that you're doing this talk.
Yes, I am. Yes, I am. Like I said, it's extremely important. Most people know me as a guy who likes to kid around, but not with medical stuff like that. I think it's important. I think we owe a great deal of respect to women. Who I
Hmm.
think I told you last time. I think a woman is the mother of civilization to bring the children in the world, take care of them and stuff.
Hmm.
And no matter what, most of the time she gets stuck with all the children. Then whether the father leave, whether he's married, whether he works out of town, mom
Hmm.
is a big plus. God knows a tremendous plus, and I take those matters very, very serious. Obviously,
Yes, really, and really be thankful for our mothers. And Mother's Day is coming up, and we should celebrate our mothers every single day. But if you can, if you have not been in contact because of whatever problems that you may think of, perhaps that may be the day to just say, let me pick up the phone and let me just say hello. Let me come back into my life here, you know, however best you can.
I agree. I agree.
Hmm.
Definitely agree. Okay,
Hmm.
so I'll let you start, and I'll listen through, and then we'll go from there.
Thank you. Thank you again. So, as always, and again, I'm so grateful and thankful that I was given the opportunity to come back and talk with you, Mr. Lee. But as always, I start off with this. And again, I say to those who are of other religions that this is not something to ignore, but to just be respectful of. But I want everyone, I will praise you, for I am fearfully and wonderfully made, to always remember that and to keep that as your mantra. Today, we're going to talk about menopause, which is another natural stage in our lives of women. Next slide. And before I actually talk about menopause, I just wanted to just give a little brief history on women, because we have, and I was, as a gynecologist, we have Dr. Sim, who you may have heard was the father of gynecology. And once we started to understand the full history of Dr. Sim, it has been changed, because it recognized that yes, he learned about different types of how you treat women, vaginal surgeries that were done for fistulas, which are holes between the bladder, or communication between the bladder and the vagina, or the rectum and the vagina, which happened due to a traumatic vaginal childbirth, with injury, and has done this and has studied this and brought this into place. But when you look at the actual history, this man is not a gynecologist, a physician who in Alabama actually gathered female slaves, um, from other slave owners, who said that these women were not able to provide for them because they had gone through a delivery and were injured. And these are women as young as 17 and 18, and about 13 that he gathered in. And what he did was to operate on them without anesthesia, without their consent, because these were enslaved women and had no right to a consent, and did this, operated, then re-tore the vagina, again and again and again, to develop his surgical skills. Took that from there and came to New York, and then used that as something that also brought him not only money but also the fame of being called the father of gynecology. But we start to recognize that he is not necessarily the father of gynecology because of the ways that he started. But we recognized that we looked at the women, 13 of them, and we took particularly Anarcha, Bessie, and Lucy as the mothers of gynecology, and paid tribute to them for the fact that they had to undergo this torture. And because of what they underwent, we now have so much history that we can treat women. And this is a monument that was made to them and is set up in Alabama, and it has the three women, and it shows them one without the uterus to portray how that was torn from her, and then using articles that were thrown away because they were considered just throwaway and that they were not recognized. And I wanted us to understand that women, we have been our own mothers of teaching and have gone through a lot, and specifically our enslaved women who had to undergo such horrors, but that was a foundation to us. So I just wanted to recognize the mothers of gynecology, Anarcha, Betsy, and Lucy. Next slide. So again, we're going to talk about the anatomy just a bit. And when we talk about female anatomy, of course, we look at the breasts and recognize treatment, evaluation of the breast. And I'm going to talk a little bit about that as it relates to menopause. Next slide. And as always, we're going to talk about the anatomy. And this one, I want to start with the last time I talked about the uterus and the tubes and ovaries, which we'll go over again. But now I'm going to talk about the external anatomy. This is what you can take a mirror and look at. It's between your legs, and it's the vulva. People used to say the vagina, but the vagina is inside. Then you have the lips of the vagina, or the labia minora and the labia majora, the clitoris, the area where you urinate from, which is the urethra, the vaginal vault that goes through with introitus, and the rectum. And that makes up our vulvar area. And we talk about that because as it relates to menopause, how it can be affected. And I just want everyone to understand the anatomy. When I go to the next slide, that's going to show an actual vulvar. And I preface that to just say I apologize to those who may take offense, but this is our normal anatomy, one type of our normal anatomy. And one of the things I want to emphasize is that, yes, you may see the brown color because that's the skin, but this is the basic same anatomy across women. The labia may be larger or smaller. The clitoris may be larger or smaller. The area where we urinate from, that's the urethra and the vaginal vault. And again, I emphasize to women, please do take a mirror to take a look at yourself to see what is normal for you And if there's any abnormality, changes in skin color, bumps or lesions that may occur, painful lesions or itchiness or discharge. Another part of our anatomy, next slide, is our internal anatomy, which again is the fallopian tubes, the ovaries, the uterus, and the cervix. And I'm not going to go into about because it's not about anatomy, but to talk about menopause. But we talk about the ovaries because the ovaries are what creates our estrogen, progesterone, and testosterone, which are the hormones which then act on the uterus to prepare it for pregnancy. And if no pregnancy occurs, prepare it for menstruation, and then also development of the tissue within the lining of the uterus. Next slide. And I again emphasize this is a picture just looking in the abdomen of a woman. Doesn't matter whether she's black, yellow, green, whatever color, because this is the same. It's a normal size uterus with the tubes and ovaries. This is what normal size looks like. And this is what looks like in your abdomen with the bowel below and the bladder above. Next slide. So now let's talk about menopause. As I was saying before, we talk about when a baby's born, baby has some estrogen, if it's a female or even a male, have some of the estrogen from the mother, which will then decrease. And then as time goes on, as they get older and they go into puberty, estrogen levels start to increase so that they would start menarche. And then they go through that whole cycle, which is a time when they have regular periods, again with ovulation, and again this is the time when they're able to get pregnant, again to give birth. And again, I'm not talking about this cycle, we can talk about that at a later point, but I just wanted to point out that the estrogen levels increase and then they start to decrease after a certain point, and that is around age 40 to 50 when you start to see a decrease. We're at our maximum in the 30s and then start to see a decrease. And this is when we start to say we're now moving into menopause. And by the age of 80, you have very little estrogen in your system. But I emphasize this is all normal. This is all in the same range. And we need to remember that. And remember that we are fearfully and wonderfully made. And remember, we start off low estrogen, no estrogen until the ovaries become activated and they start putting out estrogen and progesterone. We go through the next stage after menarche or after our periods start. And then we go to the final stage, which is menopause, which is normal, which is another stage before we are dying. And at times, we may very well be in menopause longer than we are in any of the two prior stages because we are living longer. And it is a natural thing that we should embrace as well as understand. And when we understand that menopause is a normal natural cycle or stage, the symptoms that occur with it are what we're going to talk about because that is what aggravates women or can sometimes cause them difficulty. So now let's go into our next stage. Next slide. So menopause. Simply, your ovaries stop producing progesterone, estrogen, and testosterone, which is the androgen. We make these normally, and then with menopause, they start to decrease. We say you're in menopause when you have stopped your period for 12 months. However, there's different things that may be occurring. You can be perimenopausal. And also, when you are in menopause, your periods have stopped. If they return, that is not normal. Your periods do not return. If you have bleeding, that is not normal post-menopause. When you say that you're now in menopause, you do not have any more periods. They do not return. And that was a mistake when I say return. We do not have that. You have what's called postmenopausal bleeding, and you want to have that be evaluated by a gynecologist. So when we have no menses for a year, you're saying you're menopausal. And the time period before that can be perimenopausal. So that can start from 45 to up to 55 years of age. And you may say, well, when would I go through? Talk to your mother or your sisters because they would all probably be in the same time period. And it can be as early as 45 or as up to age of 55. If it's before 45 or before 40s, then that's what we call premature ovarian failure. And that's a whole nother cycle or a whole nother stage. Next slide. So now I say I am fearfully and wonderfully made. But then, how does menopause affect the body? Before I even start with that, again, menopause is a natural state. In some African areas or countries, they recognize that when a woman goes into menopause, she is now considered the matriarch because she has not to worry about periods, not to worry about pregnancies. She has had the experience and now she's able to lead. And so they cheerfully enjoy that and embrace it. And I want us to embrace each and every stage of our life. But as menopause, because of decrease in estrogen, progesterone, and testosterone, there are different effects that can occur. And this talks about the different ones. And I'm going to go through each one of them to explain them and give a little bit of how um, we help to manage them. But I hope that with the questions, we'll go with that further. So, the first one is the hot flashes, where a woman may feel this heat that arises, and then they have this sweat, which can occur at night or throughout the day or every hour on the hour, which will drench them and then goes away. Now, we're not exactly sure why that occurs, but we do know that it's related probably to the hypothalamus, which affects our internal body temperature. And so, this heat that occurs, the body temperature is off, is heated up, and the body then tries to bring it back down, which is why we sweat to cool it off. Different things can bring that on. Caffeine can increase our body temperature. Stress can increase our body temperature and cause us to start feeling the night sweats or the hot flashes. How do we manage that? Some basic things, and I'm going to talk with them before talking about hormonal replacement therapy, is a fan, ice water, because we do know our bodies and we know we're starting to feel that. Start to drink ice water, which will help to bring your temperature down faster and hopefully stop the hot flash. Cut back on caffeine as much as you can, if possible. Totally cut out the caffeine and see if that can actually help. Stress. And stress can occur simply because of the fact that we are going through so many changes and we're so stressed from that and wondering, I'm getting older. What's going on with me? How do I manage that? Trying to stay calm, giving yourself the minutes of going through meditation to calm yourself, learning deep breaths, different ways to decrease that stress. But if the hot flashes are causing you a change in the quality of your life, then there's other ways to manage that. And that's where you can talk with your gynecologist. Another thing with menopause that occurs, yes, we know as women, we have our breasts and our hips, and we start to say, oh my gosh, now I'm getting this fat around my abdomen that does not seem to go away, no matter how much I exercise, no matter how much I don't eat. It does. The decrease in the estrogen starts us first, that it starts to shift our body fat from the hips and the breasts to the abdomen. The cells start to store more fat because of a decreased metabolism, and we start to have weight gain as well, which is difficult to go away, especially because it's in the abdomen. This occurs in women starting at age 40 to 59 with a decreasing in the metabolism because, as you saw in the prior slide, there's a decrease in our estrogen. After the age of 60, three quarters, 75% of women can be overweight, and we follow the BMI, which needs to be changed but modified, but we do use that. Anything over 30 is like first degree obesity. This increases our risk for diabetes, for hypertension, for cardiac disease, heart disease. So we do want to address that with the slower metabolism and the weight gain. And then also as we get older, we tend to not exercise as much and perhaps eat a little bit more, become more conscious of what we're eating to decrease the carbohydrates, decrease the sugar intake, perhaps try to exercise. And I'm not saying go and join a gym, but simply saying, if I'm driving, let me park my car away from the 5 blocks or 10 blocks away from work and walk. Or if I'm taking the subway, let me get off one stop before and walk. These are different things that can be done, not alone, but with others as well. Another effect, depression, anxiety, and mood swings. This can occur with menopause. It is not menopause, but it can occur with menopause because of the decreasing in the estrogen and the progesterone and all. And if you start having hot flashes, you have less sleep. And lack of sleep can cause us to become more depressed. Then we know it's a change in life. Again, you may feel that you're not looking as well. Remember, we're fearfully and wonderfully made. Each and every stage of our life, we're still beautiful. And you start to worry about that and say, am I not as attractive? As and worry about what people think, and that you may not be as quick as you usually are. This could cause depression or a mood swings, anxiety because you're like anxious from the lack of sleep. Again, how do we manage that is to look at what might be appearing and seeing how we can treat that. Again, some of the base things of St. John's wort, but we can actually use medication as well. Insomnia. Now I know for me, I have my personal summers. You wake up in the middle of the night because it's so hot, you turn on the air conditioning, throw off all the covers. Then it's like, oh my gosh, it's so cold. I can't go back to sleep. You put them back on and you go through this cycle. So you never really have a full night of sleep. So you have the insomnia, or you may not even be able to fall asleep as well because of the decrease in the estrogen and progesterone. This is something, again, how do I manage that? And we can talk about different ways. I will tell you like a little joke, and I'm not endorsing drinking cow's milk, but when we give our children, when they were going to bed, we give them a nice hot glass of milk, because when you heat up the milk, there's a certain peptide that is formed that can cause you to fall asleep, which is why we give them just before bedtime. Some of these different things. No caffeine. Go to bed earlier. Different ways of managing that. Another thing that occurs: hair loss and brittle nails. The estrogen and the progesterone, the estrogen helps to make the keratin, which is what we need for our nails and for our hair and for us to grow. And it's not so much just a decrease in the estrogen and the progesterone, but the increase in the androgenic effects. Because we decrease that, then the androgens or the testosterone increase, and that causes the dryness and the brittle nails. How do we manage with that? Again, you talk with your hairstylist. If not, there's different ways of saying to get the keratin, more moisturizer. Water is like your best friend, decreasing the hot flashes, but also to hydrate you. Brittle nails, moisturizers that can help with the skin, and being aware of how do I handle that. Oiling your scalp as well. I'm going to go next to bone loss and osteoporosis. After the age of 35, we create less bone, and we lose more bone. So it the organism of the organized way of when we are managing, we may have bone, we always have bone loss, but we're always creating more bone so that it balances it out. This now time it switches, and we can develop osteoporosis, osteopenia, um, or just in the general bone loss, and that is something that is of concern. Now, they usually would say white women, people that smoke have a higher risk, but it doesn't mean that we as women of color do not have that risk. So when you are in full menopause, they start recognizing perhaps doing a baseline bone scan or a DEXA scan to look at your bones to see whether you do have any bone loss or not. You want to make sure you're taking in calcium and vitamin D, because the bone loss can cause different things. If it gets to the point of osteoporosis, that means your bones become porous. If it becomes porous, that means it becomes weak. If it becomes weak, that means it's more inclined to fracture. So we're at increased risk for a hip fracture if we fall. We're at increased risk for our vertebrae crunching into each other. So you see people who tend to look like that they're getting shorter, but the vertebrae are crunching up. So that's just something that you want to be aware of. If you smoke, stop. I'm not going to say please. I'm not going to say why. Stop. Again, being aware of your health. Next stage that's occurring, decrease in estrogen. Well, let me do some more things. As we know, for children, as they're growing up, we want to increase their calcium. We want to make sure that they're taking in calcium because of their bone formation. We do the same thing as well. We want to take care of this because of the bone loss. Again, I'm coming back to dry skin and skin problems. Estrogen and progesterone helps to give us the suppleness of our skin. As we decrease that, it causes us to lose the elasticity, and our skin starts to sag. so we can get the jowls around the different areas. We also have irritated skin because it's getting very dry. So you may have like a contact dermatitis that can occur, or a lot more itching and rashes that you notice. You may also start to have acne as well because of the dryness, and sometimes the pores get blocked. These are different things that can occur with estrogen, the lack of estrogen or the decrease because of menopause. How do we manage that? Moisturizer. What is our favorite drink? Water. Moisturize your skin. Also, do the sun protection because of the fact that the sun also causes a dryness and can break up the skin to help with that. And if you have further worsening skin problems like rosacea or other things, see a dermatologist to see how much that can help. Dry eyes and dry mouth. You may sit there and saying, I for one wear contact lens. And I'm like noticing it is not as easy for me to take out my contact lens every night. This seems like my eyes are drier. Yes, they are. Because again, the contact lenses wearer you would notice that there's more dryness, that your eyes are not as, they don't form as many tears. And this is again to the decrease in the androgens, not necessarily decrease in the estrogen, but the decrease in the androgens. So our eyes are not as moist as possible. What can we do? The eye drops to moisturize it. Um, get into the habit. Maybe I don't wear my contacts all the time, and get into, let me see how I can dress up with my glasses. Again, you work how you need to make you feel better. Memory loss, poor concentration. You know, you get up and you say, you go into the room, you're like, oh my gosh, what did I come in here for? Or you're saying something, you don't remember that word immediately. Now, this comes with menopause as we start with a decrease in the estrogen, and it is normal that can occur. You may say, oh, shucks, what am I going to do? This is a normal occurrence and it will pass. It's when it doesn't pass or it becomes disruptive to your lifestyle that you want to be able to be evaluated to see what's going on. This is not because I forget a telephone number or can't remember a person's name, or get up and walk into a room and can't remember, why did I come into this room? It is not a sign of dementia or Alzheimer. It is the sign of, yes, a decrease in estrogen, and I need to do more. And I want to emphasize again, increasing like some of our fat, certain types of fat, which helps to coat our nerves, to keep our nerves healthy as well. Brain health. Those are different things that can occur. And then um, the last thing I want to talk about is our sexual dysfunction. And I'm going to move to the next slide to go into that. Next slide, please. I'm going to skip that one and go to the next one and come back to that. So, our sexual health, and why I put this as it's separate, because we don't talk about this. This becomes taboo. We don't talk about it when we're younger, and we don't talk about it when we're older. And our sexual health is a normal health. And in fact, it should be. We're now in menopause. You stop worrying about your menses. You stop worrying about pregnancy. So then now you should be able to say, well, I can now enjoy sex because I have less concerns. And I'm talking about this in the sense of looking at arousal, the G spot. What is it that helps to increase our libido? Orgasm, masturbation. And then there's the surgical removal of the uterus and cervix, and our sexuality. And this is something that you may want to talk with your partner, but also for you to recognize for yourself. This decrease in libido does occur because of our decreased estrogen, because of our decreased testosterone. But it's not something that we say we settle and stop. We're here until we are in our 80s. And this is no judgment, but we can talk about Al Pacino and Robert De Niro having children at 70 and 80. But then when we talk, turn it the other way, of Cher, who is in her 80s and being sexually active and proud of it, there's a shh. Oh my gosh, what's going on? Let us embrace this. And we want to talk about this because I neglected to talk about the vaginal dryness that can occur, and because of the decrease in estrogen. And so you have atrophy of the vaginal wall, which can then make sex painful, and you stop. You also would have the decrease in libido, where you would need to have more time for arousal so that you can enjoy sex. And again, we're concerned about, am I going to reach orgasm? That may not happen all the time, but allow for that. So it is something where you want to be able to discuss with your gynecologist, how can I manage this? And it's okay as well. There's no judgment, no judgment whatsoever. It is okay to say, okay, I'm happy with not being sexually active. I'm okay. It is also okay to say, I want to continue to be sexually active. And it is okay. What is necessary is that you understand this is what's best for me. I am at peace with what I decide, and I am fearfully and wonderfully made, no matter what it is that you may think. But I know myself and my God, or whoever I worship to, has made me in a beautiful, wonderful way. So, again, talk about our sexual health, and hopefully, we'll get into some of that as well further. Next slide. And I do want to emphasize that even with the vaginal dryness, that things can be managed, that there's different ways. I didn't start talking about hormone replacement therapy, but that is very real for the first 5 years of menopause, because that's really when a lot of the symptoms are there. That if it is causing a decrease in the quality of your life, talk with your physician, your gynecologist, about different ways to manage. They can be direct vaginal estrogen that can help with the vaginal dryness, and that too can also just cause systemic. There can be systemic estrogen and progesterone if you have your uterus in place. If you had breast cancer and you cannot take those hormones, there are non hormonal ways to manage some of these different things, as I talked with as I talked to you about sleeping aids as well as other aids to help with the hot flashes, insomnia, etc. With the weight gain, they're now being addressing that and talk about you talk about those Zempic and Monjaro, which are different medications that can help with the fact that I just gained this weight, I'm exercising, I'm doing all this stuff, but I'm not losing it. How do you manage that? Because that not only is a fact about losing the weight, but it decreases remarkably your risk for developing diabetes and hypertension and heart disease, which are usually the number one killers of us. And if we can do things to help to improve our lifestyle and manage our life, that will again allow for when we are living longer to live longer, healthier, and happier. So I end off with this last slide to again talk about that you are fearfully and wonderfully made. Put that as your mantra. Put it on post-its around your house. Take charge of your health. Make an appointment with your health provider if you have a problem. The mass on your breast. Remember, as well as we get older and go through menopause, the ducts and the glands that are in the breast turn to fat, which is why mammograms are very helpful in seeing a mass. But you want to feel to make sure, because we are at risk. 1 out of 8 women develop breast cancer here in the United States. If you have spotting, bloody discharge, or bleeding after sex or after, in menopause, not normal, go to see your gynecologist. You may tell your primary care doctor, but ask to see a gynecologist. Bleeding or spotting after sex, go in to be seen. And again, I talk about burning with urination, not because you're having a urinary tract infection so much, but because of the vaginal dryness, you can have start to have this burning in your sensation in your vagina, and it can cause irritation. So you want to go in to be evaluated. If you notice a discharge from your vagina or breast, go in. Feeling sad, loss of interest in sex, not feeling well, go in. Take care of yourself, because you are fearfully and wonderfully made, and should do all you can to make sure that your entire life, which is a gift to each and every one of us, is the life that you live in good health, happiness, and joyfulness. So, last slide. I again want to thank you, as always, for Mr. Lee for allowing me to come and speak and talk with people about this. If you have questions, feel free to WhatsApp my cell phone as well to have those questions answered. And again, menopause is a normal, natural stage. It has its symptoms that can be evaluated, that can be treated. But remember, we are wonderfully made. Thank you.
Excellent presentation. Wonderful amount of things in that you cover. That's very educating. And more importantly, given each patient that come across these type of things and where to go to get help, where to ask the proper questions, and where to, don't be afraid to talk to your doctor about your body and stuff like that. I have
Mm-hmm.
probably about 4 or 5 questions with some of the things that you cover. One of the things that always brought attention to me is the perimenopause. Always wanted to know, how does it affect a woman's body? I guess it's the first stage before menopause, but there are trickling signs when the perimenopause start in your body. How does it affect their body, and what is their expectation at that time with the uncertainty of the situation?
Excellent question. And I'm glad you brought that up because perimenopause would have come around because remember we said menopause occurs when you have no period for 12 months. Okay. Perimenopause is when your periods start to slow down. I know sometimes people say, "Oh, my periods come like every 2 to 3 weeks, and it's very heavy. I'm probably perimenopausal." No, that is something that needs to be evaluated. Perimenopause is when your periods get further and further apart. You may have your period this month, and you may not have it the next 2 months, and then it comes back again, and it may be a little bit heavier because you have not had it, and the lining may be thicker, so you have a little bit heavier bleeding, but it's getting further and further apart. And even still having the period, because you're having a decrease in the estrogen and the progesterone levels, as you can see, um, they may be that you start having some of the symptoms. So even with still having your periods, you may start to feel some hot flashes. You may start to have some vaginal dryness because of the fact that the levels are dropping down, but and causing some of the symptoms, but you're still having your uterus react. And what you want to be aware of when you go through menopause, you go through. You don't have bleeding again. Your period does not come back. The other thing is that we say that the average age is 51. So it's like a bell curve. And you may start earlier at 45 and you may start later at 55. But you want to make sure that you go into your doctor when it's after 51. Go in regularly. In fact, just go in regularly to your gynecologist to have a discussion about what's going on with my body to make sure you're staying on point and that things are not happening that need to be evaluated differently from just simply saying it's menopause.
Very well said. Importantly, most menopause usually start between 35 or 40 to 51. Yet still, some women tend to have it earlier in some cases, not in all cases. What constitute that they have it at an earlier age than the 40 or the 50? Is there a particular reason in their bodies?
Yes. Yes, so that's what we call premature ovarian failure. So that's before the age of 40, when your ovaries stop putting out the estrogen and progesterone, and you stop having your periods, and you are what we would say that you're in menopause, but we actually say premature ovarian failure because a lot of women are coming in and they're under 40 and they're trying to get pregnant and they cannot. And they're saying, my periods have stopped. And it's like, well, how do we manage that? Because if it stops and the ovaries stop working, you're not going to get them to start again. Sometimes it does reverse. It just happens and it may go away. But you would have what we call premature ovarian failure. And that is something that you want to come in because that even more exaggerates the osteoporosis because you now have less years of getting the estrogen and progesterone. So it's remarkable. You also, if you have surgery, for whatever reason. So before the age of 51, before you have what we call surgical menopause, which is an abrupt occurrence, and you can have the hot flashes, etc. So there's different reasons that may occur that you're having menopause at an early age. Maybe that you have breast cancer or you have another type colon cancer and have radiation and or chemotherapy that affects you to have premature ovarian failure. So these symptoms again, 45 to 55 is when we say you start menopause. Prior to that, come in to be evaluated to see why your periods are getting further apart.
Amazing. My research tells me the same thing. Because of ovarian failures, the menopause tend to come to a woman earlier. When something like that happen, um, what is the changes in the bodies? Is there hormone changes in the body or other issues them that come along with this also?
Yes, there are the changes because now premature, remember, the ovaries are what makes the progesterone, estrogen, and testosterone. So premature ovarian failure says that it stops. It's not ovulating, it's not putting out these hormones. And it stops at such a younger age that you would be, it's more exaggerated, that you have may have the hot flashes, the vaginal dryness, the anxiety, because it's like, oh my gosh, if I was waiting, and we tell women when you're starting to hit 35 and 40 and you're still thinking about having children, think about preserving your eggs, freezing your eggs, because this may occur and we can't reverse that. And some people are not able to talk about IVF and all these different things that can be done because of financial. So I always say if you want to have children, be aware of, do you want to birth children or to have children? It's two different things. And if you go into premature ovarian failure, you want to be able to say, how do I manage that? And with that comes also the whole concern that I'm not a woman anymore, I'm not feeling fine, all of these different things. We do emphasize, because it is early on, because this would bring on heart disease and coronary artery disease and other issues such as osteoporosis earlier on, that we do offer hormone replacement therapy for these women to help protect their bones, help protect their skin, to bring them closer to 45, 50 years of age. And so we don't have that longer period of no estrogen in the system.
One, one of the things that amazes me, each person with a menopause have different symptoms. Most of the time it's usually hot flashes, but every
Mhm.
woman body is somewhat different at time. There are other things that hot flashes might not come right away, but eventually down the road it gets there. There are some other symptoms that tend to bother them, stuff like that, a certain amount of anxiety, a certain amount of
Mhm.
stress, and stuff like that. How do they cope with things like that, Doc?
So again, this is something that comes, it comes with it with age, yes. And the hot flashes may or may not, because there's women that just go into menopause and they're like, I didn't notice anything different. My periods just stop. I'm good. That's where you talk with your mother and your sister and see, because you may very well be at that point. There are other women that will start to have the hot flashes, which will then start to let them be aware, you're getting older. Um, and there may be anxiety that increases, especially if you've not had children. And you're concerned that that's not going to happen. Or you start to have the vaginal dryness, or your skin starts to not be as plump and it starts to fall, and you start to say, oh my gosh, I'm looking older. And the weight gain that occurs with the abdominal pain, weight at the stomach as opposed to the hips and the breasts, all of these different things that can occur with menopause. But remember, menopause is a normal stage. You may or may not have all of them. You may have all of them. You may have none of them. Understand though, we all go through menopause. What you want to do is to look at the symptoms that do occur to you and come in for evaluation. That depression, feeling tearful, feeling anxious, come in for evaluation. That can be evaluated. Do not suffer. Do not allow something that is causing you to be saddened in life to have a decrease. Like, you get to the point where you're saying, I can't do this every day. I had a young woman, she was 60, and talk about, I'm just sweating all the time. I can't go
Wow.
out because I'm like feeling all of this, and I'm just, it's too much. And she cuts back on her social. No, come in for evaluation. And also talk to your partner, because your partner, whether be it male or female, is also going through this. And the two of you talk about it. This is why they say we leave children to the younger people. Because when I hit 60, I can't be running after a 2 year old. That's just not going to happen. I'd rather be the grandmother and say, take your child home. Understand that we change with life. Change is an automatic. We can't stop that. It is to adjust and to say, well, how do I change my lifestyle? We don't do what we did when we were 20 or 30 because we're not 20 or 30.
Matter of fact, the partner should be involved in these type of conversation with his wife, and don't be afraid to go to the doctor at the time when they talk. It's important so he can be a participant as long as his wife is along with it. I got a good question as the last one for you. If a uterus was surgically removed through hysterectomy, will a woman know she's going through menopause, or she have no way of knowing?
So if the ovaries are still in place and just the uterus being removed, now sometimes the ovaries will have less blood flow and sometimes they will stop working. But you will still have the estrogen and progesterone being produced. You're just not having your period. So you won't notice a difference. However, some women know my uterus is gone, but I still feel like every month I get this sensation of some kind of cramping. But I'm not having my period. It just happens and then it passes. That can occur because the estrogen and progesterone are up and you're having all these different sensations and you may feel some type of cramping. You may feel some change, monthly as it goes up and down. And as I said, as long as the ovaries are in place. Now you can have your hysterectomy. A total hysterectomy is just removal of the uterus and cervix. Bilateral salpingo-oophorectomy and hysterectomy means that your uterus, tubes, and ovaries are removed, and
Mhm.
therefore you are now in menopause because whoosh, we have removed the supply because it's a gradual thing. Remember, as I said, the estrogen gradually, but when you remove it, you will notice remarkable change. And yes, you're not having your period for sure. And if you had removed because of fibroids and bleeding, yeah, you've now taken care of that. But now I'm having these hot flashes. I'm having this vaginal dryness. This is a lot. And sometimes you wonder, did this surgery help me? Because now I have a whole nother set of things that happen. And again, we talk about hormone replacement therapy for a period of time. You don't need it forever, but perhaps to replace some of these different things to help you with your quality of life. Because gradually you will be in full menopause and not have to worry. You won't have the hot flashes. You may still have some of the vaginal dryness, but there's different things that can be done for that. You will have the abdominal
The
weight.
symptoms.
So it's like, how do we manage this weight gain? And again, diet and exercise alone is not it. But remember, we do need to address diabetes and heart disease and taking care of that and working with your primary care and your GYN as to keep yourself healthy. Continue with cheap, free exercise and diet. Continue with that and improve upon that. And that will help you to feel better. And what is your best drink? Water. Water. Be aware of taking care of everything for yourself physically.
There have been a couple of
And
cases where, because of menopause, sometimes some women lose their sex drive. Is it they lose their sex drive, or their vagina is too dry? What are the help they can get in a circumstance like that? They had a wonderful marriage. All of a sudden, menopause in the picture, the hot flashes, the different symptoms, and now they don't want to make love with their husband. It's not that they're doing it intentionally, but what their body is going through at that moment. What is the answer to such a complicated situation like that?
one is just that, is to talk about it. That is not necessarily normal. Like you said, you have a normal sexual lifestyle, and then all of a sudden it's like, oh my gosh, sex is painful because of the fact of the lack of the estrogen and the vaginal dryness that occurs, and you start to lose the rugged and the lubrication. Um, it is painful. You also don't have the testosterone, so the to get into the mood takes longer. So your libido is not there, and your libido may not be there because of the lack of testosterone, but your libido may not be there because of the vaginal pain. So you're like, oh no, I can't do this because this is going to be too painful. And then because it's too painful, I got to think of some other way. And I'm saying, honey, I'm not interested. I can't. This is where you need to talk. One, you can start with simple over the counter lubricants. Okay. And along with that, that's to help with the vaginal dryness. And along with that, because your partner as well, he too is going through changes. He too is not 20, 30. He too will have a longer time to reach an erection. He too will have a longer time for in getting into the mood as well. So does the two of you now say, let us try something different. Let us talk to each other as well. Let us have our longer time of foreplay. And part of that is actually addressing that and saying, I'm looking at you in a new way. And we are attracted to each other new. Look at something new. But even with that is to go in and say, sex is painful. What can I do? And we can offer like the vaginal estrogen, or we can offer lubricants as well. And then again, as well, even looking at the different changes in position. And also, sex is not always intercourse. It is also starting to understand we are a loving couple. We may need to change how we show our affection over time, because it may not just be maybe that I'm still able to have sex, but my partner can't, whether it's heart disease or diabetes. And so now I'm going to change how we are. That's communication is such a big part of that, and keeping that going and recognizing that this is why we grow old together. This is why we fell in love with each other young, and we still see each other young in our eyes, but we adjust the best we can because we love each other.
And we keep it going. And those final words, because of time, I want to take this opportunity to say to you, Doctor, thank you so much for being our special guest, and more importantly, imparting all these information that are extremely important to females today. I don't have words to thank you for your kindness, your preparation, and all the information that you gave us. I don't have words to thank you, and I'd like to say to you that I will always keep in mind to be an international grapevine, because you have a long family here, and more important, a lot of people love your presentation. Thank you so much, and I read it from the bottom of my heart. I mean it.
Mr. Lee, thank you. Thank you for doing this, because I love my women. I love us. I love people, and being able to impart information, because education helps. But you need to have the source for it, and you need to have someone that's saying that it's important. And you're doing this is what's important. The grapevine, the international grapevine, you can't go wrong with all the information that you impart across the board. And so I thank you for allowing me to be part of it. Um, and I welcome it. It's we are beautifully made. I love talking about us. It's just
Like,
great.
like I said, you're part of the family. I'm always going to reach out to you. You know that. There are other
Yeah.
issues them that we'll talk about down the road in the next couple of weeks. I might be away for a week, but as I come back, we will talk again and get into some other stuff. No question about it.
Why do I realize that would be the case? Yes, not a problem.
No question about it. We're going to have you back. Thanks again.
Thank you. Thank you very much.
Okay. And again, this is Wallen for Lee saying good night. Hope to see you next week at the same time at the same place. Watch International Grapevine. We bring a lot of important information to the community, and you are part of the community. So we love getting feedback from you. And most of the time, we share a program with all the folks that we can, because we want to educate your mind and bring good story to you. Good night, and be well.